Welcome back to the lecture series on removable partial dentures. We have already covered the lingual bar and lingual plate in the previous lecture. Today in this video, we will be discussing about the sublingual bar, cingulum bar and labial bar, which are the other three types of major connectors. Let us start with the sublingual bar first. Sublingual bar is a modification of the lingual bar. Let us understand the design of the sublingual bar first. The shape of the sublingual major connector is similar to that of the lingual bar, which is half pear shape. And the placement of the sublingual bar is a bit lower and it is further back to the placement of the lingual bar. It is lying on the floor, which is parallel to the anterior floor of the mouth. So sublingual bar is avoiding the interference with the floor of the mouth and even during the functional movements like swallowing and talking. When is sublingual bar indicated? When there is no enough space to accommodate the lingual bar, in that condition, sublingual bar is indicated. Lingual bar requires at least 4 mm of the space in between the free gingival margin and the superior border of the connector. If this 4 mm of the space is not present, in that case, sublingual bar is indicated. When sublingual bar is contraindicated? It is contraindicated if there is a lingual tori or if there is a high lingual frenal attachment. Let us see what are the advantages of the sublingual bar. There is an increased rigidity and also there is less obstruction when compared to that of the lingual bar. One of the major drawback or the disadvantage of this sublingual extension is it can interfere with the tongue and the floor of the mouth in only certain cases. In only certain cases, it is interfering with the tongue and the floor of the mouth. That becomes the drawback of the sublingual bar. Next, let us move on to the next major connectors, cingulum bar. Cingulum bar is also known as a continuous bar. So cingulum bar is indicated when the axial alignment of anterior teeth requires excessive blockout of the interproximal undercuts. What are interproximal undercuts? These are the areas which are present on the tooth near the gum line and they are present below the height of the contour. So if the teeth is properly aligned, so these are the properly aligned teeth where the long axis of the teeth is parallel to each other. So when the teeth are properly aligned, interproximal undercuts are shallow. If the teeth are malaligned, in that cases, interproximal undercuts become deeper. This is a case of malaligned teeth. So here, the long axis of the teeth is not parallel to each other. And so when you take the example of this is a tilted teeth towards the left side. So the tilting is towards the left side and the height of the contour on the left side is coming down and on the right side, height of the contour is moving up. So on the left side, the interproximal area becomes deeper and on the right side, it becomes shallower. So in this area, interproximal undercuts become deeper. So it requires excessive blockout. It requires excessive blockout if the lingual plate is planned. If lingual plate is planned, it requires excessive blockout. That is the reason why cingulum bar is indicated in this situations. Next, let us see the design of the cingulum bar. Cingulum bar is located slightly above the cingula of anterior teeth. These are the cingula of the anterior teeth and cingulum bar is located slightly above the cingula of the anterior teeth. So this cingulum bar can be independently used or it can be used along with the lingual bar. In what cases cingulum bar is indicated? When there is wide diastema between the anterior teeth. Between the lower anterior teeth, if there is wide diastema present, in those conditions, you can use the cingulum bar. And one of the major disadvantages of using the cingulum bar is it is not providing sufficient amount of the rigidity. So next is double lingual bar. Double lingual bar is also known as Kennedy's bar or it is also called as a continuous bar retainer. And what are the components which are present in the double lingual bar? It is having the two bars. One is the upper bar, second is the lower bar. So if you take the example of the lingual plate is like this. If you remove the middle portion of the lingual plate, then that becomes double lingual bar. So this is the upper bar and this is the lower bar. So upper bar is having half oval shape in its cross section. It is something like this. And the height of this upper bar is 2 to 3 mm. And the thickness is 1 mm. Whereas lower bar is similar to the lingual bar in its cross section. If you take the cross section, it is having a half pear shape. So upper bar is entering into the embrasure spaces. It is dipping into the embrasures. And if there is any diastema present, if there is any spacing present in between the anterior teeth, then a step back design is preferred, which is similar to that of the lingual plate. In the lingual plate, if there are any spaces in the anterior teeth, then the lingual plate design was modified and a step back cut was given. In the same way here also, if there are any spaces in between the anterior teeth, then you have to give a step back design. In what cases this double lingual bar is indicated? If there is any crowding in the anterior teeth, or if there are any diastemas present in the lower anterior teeth, or if there is a compromised periodontal support. And what are the advantages of using this double lingual bar? It causes the stabilization of the horizontal forces, and it is also providing the indirect retention. What are the disadvantages of this? It is having a complex design. So design of the double lingual bar is complex. There is a chance for the food entrapment. Finally, we will discuss about the labial bar, which is the last one of the mandibular major connectors. So this labial bar is having a half pear shape, which is similar to that of the lingual bar. But the only difference is this labial bar is placed on the labial side or on the buccal side. So the labial bar is usually thick and it is long when compared to that of the lingual bar. So when is this labial bar indicated? When there is extreme lingual inclination of the lower premolars or incisors. If there is extreme lingual inclination of the lower premolars or the incisors, where the lingual bar cannot be used, in such cases, labial bar is used. Or if there are any large mandibular tori present and they cannot be surgically corrected, in those cases, labial bar is used. What are the advantages of using a labial bar? It is a very good alternative when the lingual bar placement is not possible. The downside of the labial bar is it is visible and it is having poor aesthetics, and it is causing the distortion of the lower lip and result in discomfort for the patient. This is all about the mandibular major connectors. In the upcoming videos, we will be discussing about the maxillary major connectors. Thank you for watching. If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.